Good morning to all. I am Dr.M.Subbiah. Welcome to the ECG MDC class. Today I am going to discuss about heart rate calculation and identification of rhythm abnormality. So what's the 9-step process for analyzing the ECG? So determine the heart rate is the first step. We are going to identify is it a normal, fast or slow. And second is determine the regularity of the heart rate. Is it a regular or irregular? Third is assess the P waves. Is there a uniform P wave preceding each QRS complex? Then fourth is assess the QRS complexes. Are the QRS complexes are within normal limits? Then fifth is assess the PR intervals. Are the PR intervals identifiable? Are they within normal limits? Is it constant in duration? Then assess the ST segment. Is it a flat or is it elevated or a depressed ST segment? Assess the T waves. Is it slightly asymmetrical? Is it of normal height? Is it oriented in the same direction as the preceding QRS complex? Look for U waves and assess the QT interval. And heart rate calculation. Heart rate reflects the rate of ventricular contractions per minute and it's often expressed in beats per minute. Since QRS complexes reflect ventricular contraction, the rate of QRS complexes will provide the heart rate. Each small square in an ECG represents 0.04 seconds of time or 40 milliseconds. There are 5 small squares in each large box, thus making the duration of one large square 0.2 seconds or 200 milliseconds. Therefore, 300 large squares represent 1 minute and the number of ventricular cycles within 300 large squares will represent the heart rate. Therefore, to measure the heart rate, simply divide 300 by the number of large squares between two consecutive QRS complexes. In this ECG, the number of large squares are 3. The heart rate is 300 divided by 3, it's 100 beats per minute. It's easier to memorize the heart rates associated with each of the large boxes rather than count the number of large boxes and divide into 300. If the number of large boxes is 1 between two RR intervals, the heart rate is 300. If the number of large boxes are 2, it is 150. Number of large boxes are 3, the heart rate is 100. And if the number of large boxes are 4, the heart rate is 75. The another method using the 1500 method, begin by counting the number of small squares between two consecutive R waves and divide 1500 by that number. But this method cannot be used with irregular rhythms. What is estimated heart rate? If the number of large boxes is not a whole number, either you can estimate the heart rate or divide 1500 by the number of small boxes between P waves, R waves to get accurate heart rate. For tachycardias, it's helpful to memorize the rates between 150 and 300 beats per minute. What to do in case of slow or irregular rhythm? Identify the 3-second markers at the top or bottom of ECG tracing. Count the number of QRS complexes that appear in 6 seconds. Multiply by 10 to obtain the heart rate. So this is the normal heart rate by age. Then determine the regularity. Equal RR and PP intervals. If the distance of the RR intervals and PP intervals is the same, the rhythm is regular. In this ECG, this rhythm is regular as each RR and PP interval is 21 small boxes apart. Unequal RR and PP intervals. If the distance differs, the rhythm is irregular. So in this ECG, the number of small boxes differs between some of the RR and PP intervals. So what are the methods used to determine regularity? So using paper and pen, place the ECG tracing on a flat surface. Position the straight edge of a piece of paper above the ECG tracing so that intervals are still visible. Identify a starting point, the peak of an R wave or P wave, and place a mark on the paper in the corresponding position above it. Find the peak of the next consecutive R wave or P wave and place a mark on the paper in the corresponding position above it. Now move the paper across the ECG tracing, aligning the two marks with the succeeding RR intervals or PP intervals. So what are the types of irregularity? It could be occasionally irregular, it could be frequently irregular, or it could be irregularly irregular, where entire tracing is irregular. So irregular rhythms are considered abnormal. Each type of irregularity is associated with certain dysrhythmias. Thank you.